Hi, my name is Kim Berry, and I'll be performing a sterile dressing change today. Before I would enter my patient's room, I would gather all of my equipment. So I have sterile gloves, 4x4s, cotton tip applicators, an abdominal pad, normal saline, a cup for my saline, tape, a measuring tape, and a pen. I also have a biohazard bag. So when I entered my patient's room, I would perform hand hygiene. I'd introduce myself. Hi, my name's Kim. I'm going to be your nurse today. Can you tell me what your name and date of birth is? Okay. Jeremy Spark. And what's your date of birth, Mr. Spark? Perfect. 12/26/38. So, I'm going to be doing a sterile dressing change today. Are you in any pain? Okay, no pain. If my patient had pain, I would administer pain medications and return in 30 minutes. I'm just going to raise you up here. Okay. Okay, so I'm just going to pull your blanket down here and pull your gown up so I can change your dressing on your abdomen. So I'm going to remove your dressing. Might be a little sticky. Okay. So I would note any fluid on my abdominal pad, the amount and the type, and the same for my 4x4s. I would discard those in my biohazard bag. I would then remove the packing from the inside of the wound and note the amount and type of fluid on that as well. So I am going to measure my wound. Okay, so it's 5.5 inches long, 1 inch wide, and I'm going to measure the depth of it with a cotton tip applicator. Break it off so that I can measure it. And it's 1.5 inches deep. So now I'm going to remove my gloves. And I'll start preparing my sterile field. So normally I would have a sterile drape underneath my materials. And I'm going to open up all of my stuff. Okay. So now before I put on my sterile gloves, I'm going to pour my normal saline into my cup. I'm going to pour this with the label against my hand. Make sure not to splash. Okay. So now that I have my sterile field set up, I'm going to apply my sterile gloves, starting with my non-dominant hand. I'm only touching the inside of these gloves as I'm applying them. Then when I put on the other glove, I'm only touching the outside with the sterile glove. Okay. Now that I've got them on, I'm going to interlock my fingers. Okay. So now I'm going to clean the wound. I would take my cotton tip applicator, dip it into normal saline, start and discard that. Use another cotton tip applicator and clean the side, and discard that one. And then I would again use another clean cotton tip applicator and clean the other side, discarding that. I'm going to use one more cotton tip applicator, and I'm going to clean around the outside of the wound. Make sure there's no bacteria, no drainage on the skin, and I would discard that applicator as well. So now I can move on to packing my wound. I would take one of my 4x4s and I would dip it into my normal saline.
You said you already asked about pain and chest.
Wring it out. I'm going to unfold it. And I'm going to kind of twist it so that it will pack easily. Take another cotton tip applicator and start packing my wound. I want to be sure to make sure there's no packing touching the outside edge of the skin. Packing is only in the wound. And if I need more packing, I would take another 4x4. Dip it in saline, bring it out. Get a new cotton tip applicator.
Yeah, I think that's just, I don't think that's got like a big, it's just,
And again, I would unfold this one.
I have no idea where it is.
So, okay, and then I should have, so I should have done this as soon as I was done with my blood pressure. Then I should have
Done pulse? Yeah, I should have.
Finish up my packing here with a fresh applicator.
Respiration, so I'm going to listen to heart sounds.
Okay, throw that away. I'm going to take 2 clean 4x4s, and I'm going to place it over the wound. Alright, and then I'm going to take my abdominal pad, being sure not to touch the inside of it. And I'm going to lay that right on top of the wound. At this point, I can discard my sterile gloves. And I can now tape my dressing down.
Radio or break rate?
Oh, that's how she is.
Okay, I thought so. That's right. Okay, I couldn't remember.
And I would be sure to fold over the edges of my tape to make it simpler for the next nurse to pull the tape off. Tape it down.
Yeah, I mean, load it.
Or if you
True. True. But you still want to probably turn it off just in case if you continue feeding things, if you would make it some things associated. Oh, right. And just like pinch it or whatever, it's still important. It would affect my ability to do stuff.
Bring in the right little cloth.
At this point, when I was finished taping my dressing down, I would sign and date it, and I would cover my patient back up. I also want to put the time on my dressing whenever I sign and date it, so the next nurse knows what time it was changed. So, are you having any pain, Mr. Spark? Are you feeling okay? Alright. Raise up the bed rail, lower the bed back down to the lowest position. I would check if my patient needs anything. I would finish my procedure by discarding all of my materials, and then I would proceed to documenting what type of fluid, the amount, the color, if there was any odor, and the measurement of the wound. And that's it.